In the primary care setting, one of the most common reasons for somebody to visit a physician or a health practitioner will be low back pain. However, it's also very common to have neck pain, to have shoulder pain, knee pain, ankle pain, shoulder pain, etc. In fact, probably low back pain only second to an upper respiratory infection or like a common cold type condition will be the most common reason why somebody would visit a primary care practitioner. Unfortunately, medical education has lagged quite a bit in terms of preparing primary care practitioners for this type of complaint. Primary care practitioners, be that either family practice, internal medicine, pediatrics, OBGYN, etc., they focus more on more serious pathology conditions, heart, lungs, etc. And the amount of training that they receive in medical school even, and then in residency, regarding the evaluation of some of these very common musculoskeletal conditions is actually very minimal to none. Now, one very important point that I want to make, that it's the part that I am trying to emphasize with this lecture, is the fact that the imaging studies should not be the first thing that you order. The first thing that you should do is try to get a thorough history, do a basic physical examination, and with that you probably have 85 or 90% of your diagnosis. If you start with the other way around with the imaging studies, there's going to be a lot of red herrings there, a lot of pathology that really will send you down the wrong path when in fact the pain generator or the pain condition may have absolutely nothing to do with that. Don't get me wrong, some of these imaging studies are very important, but they are to be used in conjunction with your thorough physical evaluation, including the history of the patient, and then some basic physical examination maneuvers. Then you add these ancillary tests. Sure, in terms of the presenting, when somebody presents with some of these neuromusculoskeletal complaints, one of the main things is to do a thorough assessment to try to figure out what the patient has, because all of these conditions may have completely different treatment, or management options. Now, many conditions in the musculoskeletal system, except for significant trauma with significant derangement of joints, etc., many of them are actually self-limited. It's a matter of reassurance. It's a matter of using some relative rest, maybe some anti-inflammatory medications, then getting into some stretching and other activities in physical therapy. And in fact, many of them, over time, even left alone, for instance, low back pain, non-complicated low back pain, gets well on its own. And we're just too quick to try to medicalize this and try to, medicate people and do imaging studies when in fact we probably want to stay away from that, because that really takes us down the wrong pathway of making the person more sick as opposed to giving them reassurance that it's just a matter of time and it'll get better. That being said, it's always important to look for what we call red flags, or things that should alarm you as a provider, as a practitioner, to say there could be something very wrong here and we need to really try to get to the bottom of this. And for instance, in low back pain, we could be looking at infection, we could be looking at malignancy, invasion of the vertebral bodies, etc. Whenever you explore for some of those in the history, there'll be some key historical findings, neurological evaluation, neurological exam, as well as history, that should prompt you to say there could be something very serious here and we really need to move on this faster rather than slow. All the other patients, it's just a matter of reassurance. Many times some anti-inflammatories, if it's not contraindicated, even some Tylenol, some relative rest, ice, and then perhaps in some cases some stretching and some other physical therapy. And most of these conditions tend to get better on their own, as opposed to start doing MRIs and doing nerve conduction tests and EMGs, etc. Now, when it becomes something that continues to progress or doesn't get better after that initial management by a primary care provider, is when you're really trying to enlist your specialist and try to look for something a little bit more in depth in terms of treating these conditions.